Great.
I've started recording.
So, good afternoon, Dr. Rakesh Gupta, sir, and Dr. Rakesh Gupta from Jaipur, Dr. Ram Prasad, other researchers, Dr. Aruna, Dr. Sharko, and all esteemed faculty and the students assembled here. At the outset, I would like to thank the organizers for giving me this opportunity to share one of the best practices of regarding tobacco control and how we collaborate with the government and how it was a win-win situation for both people in academia as well as for the government sector. So I'll be sharing my slides now. So are the slides visible? Can you just press?
Yeah, your slides are visible. Just make it in a slideshow.
Yes, yes. Yes. Is it in slideshow, sir, now?
Yeah, it's better now. Yeah, good.
Right. Yeah. So the topic given to me for today is academia and program collaboration, a key to galvanize tobacco control efforts. And once again, I would like to thank Dr. Rakesh Gupta from Sipher for the kind introduction. And just to share our journey, how it things started and what we would do with good collaborations. I'm just focusing on that aspect of today. From beginning, I was quite interested in tobacco control. Whenever our head of the department or somebody used to organize some sort of health days in the college and universities, then I used to choose World No Tobacco Day. Right from 2011, we have been doing it in a small way, and we used to submit reports to state anti-tobacco cell. So that was the humble beginnings what we had. And in 2013, we did a collage competition and slogan competition for students, so that in a way we are able to create awareness among the general public as well. And we came out with a lot of interesting slogans by the students. So we made a dossier of it and given it to Government of Karnataka then. And subsequently, we started off doing research work in tobacco control, and we could garner one or two publications. By that time, I'm based in mainly Udupi district, which is in one of the districts in coastal Karnataka. The National Tobacco Control Program was slowly taking its baby steps here. Although we study in our textbooks and all the program websites that the National Tobacco Control Program was started way back in 2007, but it landed up in coastal Karnataka only after 7 to 8 years. So the first sessions were conducted in 2015, 16, and slowly from 2017 onwards, the program started. So from during that time itself, we were closely associated with district administration in trying to do whatever we can for tobacco control. Right. And then we started off with, then after a couple of publications, we thought we should be applying for some funded grants. So slowly again, when funded grants were required, as we were recognized by the district administration, we got very good support from the district as well. Right. So with this background, I'm going to start my presentation. That we know that India is the most populous country and it has a high tobacco burden. Tobacco control policies of India have been quite strong as compared to other parts of the globe. And we have one of the best practices, be it tobacco pack warning. We also boast of tobacco free film rules, which is an example for many countries outside India as well, many countries abroad as well. So in spite of that, we have struggled for effective implementation. Many studies have been done, and some of you here in the audience might be familiar with some of the studies, or you yourself might have done some studies. wherein we have found some gaps in implementation. There are several gaps in implementation of the tobacco control laws. So if you see that even though we have the best policies, there will be some uh, lacunae. In such circumstances, there is a need for involvement of medical, dental, and other health science institutions. It aligns with our objective of improving the health of the society as well, very closely. So we are not involved only in teaching students. It's one of the important aspects of it. But then indirectly, be it any organization, whenever we are audited, whenever we are asked, they do ask us, what is your contribution with respect to the government programs? So in that case, when there's a need in the program as well, at the same time, we also have an obligation towards society. This matches well. This synchrony matches well. These collaborations match very well, and definitely useful initiatives. So we know about the rich, the vastness of our country. India has around 28 states and 766 districts. When you come to the uh, National Tobacco Control Program, or people exclusively working for tobacco control in a district, we see that only 4 to 5 officials are working exclusively for tobacco control. We also read in the program that there are several options which are mentioned in the NTCP as well as COTPA, which encourages collaboration with like-minded organizations, be it academic institutions, civil society. Lot of civil society is involved, civil society organizations are involved in ensuring tobacco control efforts in the country. So effective implementation, if we want to do, of the demand supply reduction strategies followed by intersectoral involvement, has been highlighted in the literature. We see a lot of examples. One of the best examples, what we see coming out, the best results are coming out because of good collaboration. And the process of national multi-sectoral policy formulation, adapting it as one of the state level objective is also depicted, and we have good examples. From beginning, Sipher has been involved, RCTC, PGH Chandigarh, organizations like the Indian Dental Association. Lot of organizations have lent support in implementation and strengthening the program. These are the key Indian policies. If you see, the COTPA Act is there, the National Tobacco Control Program is there, tobacco-free educational institutions are there, and tobacco-free film and television rules. Subsequently, we have on tobacco pack warnings, we have on tobacco-free film rules. We recently, with the collaboration, multi-sectoral collaboration with the civil society involvement, continuous advocacy, we are able to ban or prohibit the e-cigarette menace also in Indian context. But in spite of that, all these policies, if you see, there is a need for joining hands with these policies. One of the government official, in a lighter way, mentioned once to me that yes, it is not that the government can do everything. There is a need for like-minded people to join hands. Now, with the policies in place, we have the weapon to fight out tobacco. So, government is helpful in developing the newer policies, the rules which are required due to the changing times, so that they are able to do, and hence we can join hands with them and try to contribute more towards them. So every district in the country, if you see, is working hard to reduce tobacco use. Again, it is not the solely the responsibility of the district. At the district level, if you see, the 4 officials are there under the program. The district level coordination committee is set under the chairmanship of the deputy commissioner, and all the members, they are supposed to attend the meetings and give their inputs. That includes other government departments and also the private institutions, the NGOs or other interested people will join hands in that. Right. When we started off in 14, 15, that time, I still remember I went to the deputy commissioner and told that I am interested in tobacco control, contributing towards tobacco control. And then permit me to start a committee at the district level so that we can meet once in 3 months and we can discuss the issues and we can address this issue in a tobacco use issue, tobacco aspects in a war 14 during that time. Jokingly, she mentioned that there is already a committee. Some of the officers don't come when I call. Then will they come when you call, you being in a private medical college? But then she was very happy to take the suggestions at that time. And I'm really fortunate for her giving me an opportunity. Immediately, she called up the DHO, district health officer. But there is one person here who has come to me, is very interested. He has done a lot of work in tobacco control. Why is he not there in the committee even now? So within a week's time, I got a letter from the government also that I have been nominated as one of the members for district level coordination committee for tobacco control. So I personally I feel that there are several things for the government to implement and enact. But if at all anybody keeps an earnest step, there will be like-minded people in the government who are very much eager to take us into their fold. So when you have, your name, you are a part of that committee which decides on the course of tobacco control, that makes a big difference, I feel. Rather than just sitting in your offices or in your academic institutions, if you don't get involved in government programs, then we may not be able to reach the last person in the society. If at all we want to, we got to have get into these government committees. So coming on some statistics here again, India has approximately 706 medical colleges and 324 dental schools, dental colleges. And tobacco is a common issue for the government, for the medical professionals, for the dental professionals. So we have Dr. Ram Prasad also here, who has been very active in our district for tobacco control. So it shows his commitment towards the tobacco control efforts in the district. And I wish, last time also when I wrote this compendium, and Dr. Rakesh Gupta from Jaipur is here, he also liked this idea. I wish every district, wherever medical college or dental colleges are there, faculty from those institutions, those who are interested in tobacco control, should be a part of the government committees for making a difference in the way program is being run, to give key inputs and so on. So just a minute.
Dr. Muralidhar, there
Yes,
is
sir.
there are comments in the chat that your voice is not clear. So can you use another mic or just leave it?
I'll
And
just leave it, sir. I'll take out this mic and let me know if it.
Yeah, you can use your laptop mic.
Yes. Is this better, sir, now?
It's better, really. Yeah, it's better.
Okay. So this. So that initial steps, reaching out to the government officials, straight away the deputy commissioner, and then expressing our interest, really worked wonders for us. And that was a big encouragement. And every quarterly meetings, initially when we started off with tobacco control efforts, we were asked to present latest updates, be it some research activity, what is going on, or some new finding has come out with respect to tobacco control. All these things we could really present there. And even the government officials at the district level, they started getting awareness about these aspects, and they used to clarify the doubts as well in the meetings. Right. So that was one big boost for us, for our team. and then we could really that made a difference. And we also felt noticed, we were recognized for what we were doing, and that gave a new encouragement also for us to contribute more towards tobacco control efforts. So with this, we regularly used to present, as I mentioned to you, about the findings, what we, as well as in the local context also, not necessarily international or national, what was plaguing at the district level also. We did a small study on e-cigarette, and we found out that lot of e-cigarette is available at some key points. When that was told to them, unfortunately, Karnataka government was one of the initial states for us to implement the prohibition of electronic cigarettes. But unfortunately, the police, some of the police officers had not seen an e-cigarette at all. So we made a presentation how a e-cigarette looks like, so that next time they see it and they can confiscate those e-cigarettes as well. At the same time, through the initial study, we also could give leads or the inputs or summary to the government, saying which are the hotspots for sale of e-cigarettes at that time, when even the state ban was already there. The national ban came into force much later on, but Karnataka state had recognized the problems of e-cigarette and had banned it. So we conducted research on tobacco use and its impact in the population of the district. Our studies mainly focused on prevalence of tobacco use among school children and what the teachers and the police officials are perceiving with respect to tobacco control efforts and how it can be strengthened further. So regularly we give the updates. It's not just publishing the articles after doing the research studies, because early people in the local government, they may not read those publications at all. It is only for the academic researchers and conferences. But then we need to present our findings in such proceedings where all the grassroots level workers also come forward and they get to know about it and they get an idea about it, how it can be changed at the grassroots level. And with this collaboration, we could also galvanize the teams which were existing at the block levels, at the village levels, and we see that there was a significant improvement in the way the program was seen, in the way the program was implemented. So these are some of this image. It depicts like informal discussion. Not everything will be done through research study only. Informally, we used to have some discussions. We used to present it, and that also helped the government officials in a better way. Presentation of research findings. So any conference we go, before going to the conference presentation, we have presented at the district level coordination committee meeting, presenting innovations. So there was a discussion regarding tobacco-free villages, how to go about it. Then we could get some case studies from different parts of the country. We had some case studies from Andhra Pradesh. We discussed those issues and how like-minded in case villages are there, locals and government is there, how the tobacco-free village can be implemented in these districts and capacity building programs. Our team members are regular resource persons for all the activities related to tobacco control in the district. So once in 2 to 3 months, whenever any capacity building program happens, we are regularly invited and our team members impart about the tobacco control program, the ill effects of tobacco use, and tobacco cessation and other activities. So with respect to different aspects, what all we have been doing, different government departments. So one is police. So awareness on ends I mentioned to you and sharing the research findings. Department of Education. Before the academic year begins, so myself and our team members are regularly invited and we give the training program to the teachers about the National Tobacco Control Program, how the anti-tobacco education has to be imparted to the students and how that can be sustainable at the school levels. Department of Health, again, informal discussions and capacity building. We have conducted several capacity building programs for the ASHA workers, Anganwadi workers, the healthcare officials, healthcare officers, the medical officers, and so on. Again, NTCP, National Tobacco Control Program, they have been very proactive, very helpful in our district. Now, I mentioned to you that we met and spoke to them. But fortunately, in our district, we are blessed with good officials who are taking our suggestions. Doing studies on one side is different, getting an opportunity to present it, and then accepting those findings in a positive way and how it can be strengthened. That is one thing which I am really grateful to the officials in our district. They have been very helpful. So customs office awareness on ends. So in nearby district, we have airport authorities, we have port authorities. We had a meeting wherein awareness was created about ends so that the prohibition is implemented in the strict possible way. Food safety again, because if you see the smokeless tobacco, we did a study wherein we found that microorganisms were shown in some of the types of smokeless tobacco products. So we did the study, and around 5% of the products, they had microorganisms detected on culture in the microbiology laboratory of our medical college. We published this paper, but before that, we also gave this report to the government, wherein after that, there were regular raids and for the local brand, whenever there are no warnings on the tobacco packs. So such products were confiscated from the market by the district level squad, the checking squad, which does once in 3 months or 2 months. So as a result, now we did the research, we collaborated, we could do the research, especially when tobacco control issues are there. Without the government support, it is very difficult to do the research. We need the students' participation. In the sense, we need participation from education department. We need support from the police department, the health department, and so on. So they also got the key inputs regarding the program. At the same time, we also could publish the results. And we initially, when we started, we had 1 or 2 publications, but after collaborating, trying to know what the problems are. So doing research without consulting them would be incomplete. The crux of the issues are the ones the government officials are facing, the problems the program is facing, who are implementing at the grassroots level. If we take their suggestions and do the research, then definitely is more important and vital to address those research questions. So that's what we did right from beginning. We took the suggestions and whatever was essential, we coined research questions and did it. So we could get this published. Of course, that helped us in our career prospects also. Many times we like it or not. So what is in for us? Why do we do the research or anything for that matter? Right? So you can trust me. If you are interested, please continue your work in tobacco control efforts. Definitely, it is rewarding in terms of publication, in terms of career prospects, and also in terms of being recognized by your peers and getting opportunities to share your views. So 10 years down the lane, probably we didn't have as many publications as we have now with respect in peer-reviewed journals. Most of them are related to tobacco and substance use and non-communicable diseases, what we have now. At the same time, that has been a win-win situation for our careers also, and also for the program as well. And the fact that I've been called here to present in this national webinar is one of the testimony for that. Wherever you are working, when that work is useful to the society, definitely you'll be recognized and you'll be given opportunities to share your views. So I think what more is more important than these things. You have the satisfaction of contributing towards society. You also have the satisfaction of your personal and professional growth as well. So results, the research what we have done is mainly in these 4 areas: the tobacco industry interference. One of my students did a PhD in tobacco industry interference. Sorry. And a lot of school-based studies we could do and publish. Almost we are like education department officials. Initially, they had some reservation what we are doing. Next, subsequently, whenever we went, they didn't ask second question to us. We got very good letter of supports for them whenever we wanted to submit to the funding agencies. We did some work on tobacco imagery and films. Again, we could give feedback to the state tobacco cell as well, and tobacco pack warnings. Whenever there was a lacunae, whenever what are the perceptions, we also gave recommendations at the state level as also at the national level for incorporating other types of health problems as well, like diabetes complications are there, or financial complications, or social problems. All these things do have a place, because what happens, same warning at every continuously being depicted, it causes some sort of redundancy, complacency. The people will not have that seriousness. So regularly there is a need to change. So we have suggested they can utilize the newer warning signs what we have designed and studied and validated to our team. So these are some of the areas which we could work and give reports to the government. Again, Udupi district was the first district in Karnataka to implement Article 5.3. Right? Many school-based studies are also one of the landmark studies what we have published, and definitely it has been useful. The key roles what we are quietly being pursuing here at Manipal is practice, then research, capacity building, and monitoring. Being in a private medical colleges, we could reach out to all these aspects and join hands and carry out these things. Here are some of the pictures or images of the capacity building program. The first one you can see, we had training program for the police officials about the electronic cigarettes, and next one is for the teachers, wherein ill effects of tobacco are regularly taken by our team. And the next one is for the Gram Panchayat workers. Because if you see the program, one of my seniors used to comment, no? Tobacco control program, there are two important things. One is create awareness. Second thing is, those who are using tobacco, make them quit. If a person is fully aware, then definitely he will not go near tobacco. So that has to happen at the young age. And those who are using it, then definitely they have to be made aware of the problems, and they must be motivated to quit the problem. So awareness programs goes a long way. And definitely good number of people are required at the district level. Again, I am reiterating here that people in academia can be resource persons for all these training programs. So what has been the impact of our research and have been work what we have done? Udupi district is one of the high compliance district for TOTPA implementation. Whenever we have seen that TOTPA implementation was checked by external agencies also, they also have certified that implementation is above 85%. If I travel to many other districts and come back here, I feel, and maybe I am biased, that is not a right way to tell, but still, I don't have any hesitation. I feel there is a difference. Maybe seeing is believing. Some of you who are here can come over here. Maybe we will have some academic shortly if authorities at the national level also permit us. So you can visit Manipal, Udupi district and see for yourself the implementation of the rules here. Prevalence of tobacco use is definitely low. We have documented it. We have done salivary cotinine test among school children. The national average, if any students are there, can anybody put in a chat box what is the national average of tobacco use among school adolescents as per the latest GYTS 4 survey? Anybody would like to put in?
Please put in the chat.
Devang here.
Yes, sir. It's around 8.5% at the national level as per GYTS 4. If you see Karnataka and Udupi district, we stand at 1.5%. Of course, we are striving hard to even minimize it further. But then again, this stands a testimony that In the younger generation, when it is less, definitely you see the program is working well, the efforts are being taken in the right direction. Yes, we have a long way to go. We still need to control this further. 2 villages have been declared as tobacco free. We were a part of it. I think Dr. Ram Prasad also will echo. It was a very jubilous moment for all of us who are working in tobacco control. Both of us were there on that occasion to celebrate the tobacco free village being declared in our districts. So again, here we were happy to join hands. We could give the required inputs, how we can chalk out a program, how we could achieve the tobacco free village. Again, academia joining with the government in this program officials makes a lot easy and satisfactory for both the parties. This is some of the pictures wherein regularly we present our findings, and with a little bit of work at the Udupi district level, you believe it or not, state official came to my cabin and appreciated the work what we had done. Now, he was surprised that he got an intimation from ICMR that they have released a lot of money to Manipal to carry out research. So he happened to come to Manipal for some regular meetings. Then he visited me and appreciated our work. He told me state level also we are ready to give us funds to do some research on. So after those national level and international level grants what came to us, we got funding from state government also. So they were also with us, and they used to give us key inputs and what they need, and we used to work in that direction. So that, as I told you earlier also, if something good has to happen, it has to be there. The stakeholders' perspective has to be taken into consideration. We might read some 10 papers and try to find out that these are the issues, but then the real issues will be something different only. So unless there is an academia and the program collaborations, so the real research questions, the real problems will not be studied much. So that happens when there is active collaboration, there is a good collaboration and discussion at regular periodic intervals. That makes a difference. So whenever we used to have meetings, we used to get in the local newspaper as well. We used to get the reports of it, and at the state level also, then I was invited to present the study findings what we had done and to give suggestions for better implementation and effective implementation of what was at the state level also. Again, research with respect to evidence synthesis, we could do a lot of things, implementation research and dissertation on tobacco control topics. So with respect to dissertation and research, 2 of my students have completed. Really proud to share that 2 of my students completed their PhD in tobacco control research. 2 MD candidates did their dissertation, and nearly 30 publications are there in peer-reviewed journals. Started off with 2, and now we have good number of publications in there. Of course, again, the disclaimer is it's not me alone. I have a very good team. Some of the publications are with Dr. Ram Prasad as well. We work together quite a lot, and then it's a result of a teamwork. Individually it's very difficult to make huge differences, these outputs. But yes, I'm really thankful to the entire team for being with me and supported the ideas and helped in implementation. So Coalition for National Wide Research also, we collaborate with RCTC. We got many opportunities from RCTC, PGH Chandigarh, and AIMS. We could write some grant opportunities, some academic programs with these organizations. Yeah, that's really thankful to these organizations as well in giving us, collaborating with us. International consortium also, our team was a part of 17 universities worldwide, working in 3 continents, and we could implement a lot of cutting-edge research on applied aspects of tobacco control. On one way, it is awareness and cessation, but then behind the curtains, it is a multi-sectoral issue. Multi-pronged efforts are required. We could work on many of these. Tobacco taxation is one of the areas we could work because of this consortium to further the tobacco control efforts in the rest of the countries as well. So as a part of the practice, we are trying to even now ensure compliance with the COTPA. We give leads. We have a stop tobacco app. We give inputs there also. Informally, whenever we meet the officials, we give them inputs of how what new things can be done. Formulate policies at the institution levels. At a meeting with the vice chancellor, our vice chancellor, so that in our campus, try to reduce and minimize the tobacco issues and tobacco-free education institution guidelines. Currently, one of my PhD students is working on strengthening the existing anti-tobacco education in the schools so that we could further reduce tobacco use in the Udupi district schools. So these are some of the references what I used for this study. Again, I would like to, as I told you, I'm just the face of it, and without the effort, support from Indian Council for Medical Research, Government of Karnataka, Tobacco Control Capacity Program based in UK, the World Health Organization, the Global Alliance for Chronic Diseases Program, and the Medical Research Council of UK, it would have been very difficult without their support. So whatever we have some ideas, we have a good team, we have funding from the philanthropic agencies, and that's how we could achieve all these things. Again, thanks to the Udupi district administration. From day one, they never disappointed us. For whatever new ideas we had, they were forthcoming, they were welcoming. Probably many times, I have not put this in my slides. One thing is we should not go with the intention of finding faults. You should be one among them and try to improve the whole scenario. It is very difficult, very easy to pinpoint figures at others. This is not being implemented. That is not being implemented. Are Baba, you get into it and try to see what the challenges people are facing. And that is what is appreciated. From day one, our idea was not to find faults, how we can join hands, how we can ensure, because I am in an academic institution, it's not that I'm related to the program at all. I am very much ordinary citizen of this district. I am very much responsible for what is happening in a polite way, in a supportive way. How I can bring about a change was always our intention, was always our motive. So probably this attitude we should keep wherever, in whichever districts we are. We really want to make some change. So we need to be a part of the system, try to understand their issues, join hands, be a support to them, and then bring about the change. Definitely things work. And yes, it's not just that I'm telling we need to help the government. There is a lot in for us also. Okay. As I told in one of the slides about be it publications, be it career growth, be it popularity, whatever for that matter, it is a satisfying experience. And anybody who is in beginning their career, tomorrow anybody watches this video, please stick to one area, one or two areas of research, keep working in that area. Definitely you'll have much more things to offer. And you can make a difference to the society, to the program as well. So again, acknowledging all these organizations for supporting us for all these years. Otherwise, it would not be possible. Again, I would like to thank Dr. Rakesh Gupta sir from Sipher and Dr. Rakesh Gupta from Jaipur for giving me an opportunity to share some of our views and experiences till now, and happy to work for tobacco control in future as well. Anything, please do let us know. We are in the southern India at one part of in the coastal Karnataka on one side. Definitely, we are happy to contribute in any way for that matter for the cause of this society. So I would like to end my presentation with this quote: great things are not done by impulse, but by a series of small things brought together. Again, thanks to our institution who have been supporting us all throughout, our dean, our other department, our colleagues at Department of Community Medicine, KMC Manipal, and my scholars who have been the backbone of all this research. Ideas are one side, and then implementing are my scholars who have been doing it for the last 5 to 6 years. So thank you one and all. If there are any questions, I'm glad to take that.
Yeah, thank you, Dr. Muralidhar. You can stop sharing your slides. So please open up your videos for a good snapshot And in the meantime, I can talk about the presentation of Dr. Murli. So he told that it is a win-win situation for the government if the government and the academia they come together. And he was instrumental in initiating that DLCC activities. So that is also good. And he started publications way back in 2014. And initially he had a very humble beginning. Actually, he started with World No Tobacco Days celebrations, and after that, all the activities they started. He talked about the good practices in India caught by JJ Act, but I may just let him know that he can use some other anti-tobacco laws also, like FSSA for uh, for SLT for SLT ban, then JJ Act, then OTT. There was a notification last year against tobacco imagery on OTT, and the film and television rules. So they are very important actually. Uh, in India, these film and television rules are only present in India. And moreover, the OTT platform notification that is also only in India. So these also need to be stressed upon. And so you did a study. So already 30 studies, publications have been made, and a study on e-cigarette as well was done. And he collaborated with police, education department, health department, then NTCP program people, then customs and FDA. So it is a very good collaborative effort. We did it in Punjab for the NCC, and we could gather all the departments together. And the meetings were already always held under Principal Secretary Health and Family Welfare. So it was on the similar lines, and we had the academia participation also in the form of Dr. Sonogol from RCTC PGI. So it was in the same lines. So thank you in general. And Dr. Rakesh Gupta, I like your comments.
Thank you, Dr.
Also,
Rakesh.
yeah,
Am I heard?
yeah.
It's
You're
been
right.
an excellent presentation. Dr. Murli has done what very few people have been able to do, proactively approach and participate, collaborate with the district level coordinating committee. Not an easy undertaking, honestly, because you are working with a system which doesn't really move the way you would like it to move.
Yeah,
But
you're right.
you have given an example which suits the most to the recent publication we had in Indian Journal of Community Medicine, where I have advocated for integration of medical colleges in the National Tobacco Control Program, and that's the focus there. One of the agenda for working outside the premises of the medical institutions is that you get a position in the district level coordinating committee formally. That is what my thought is, that this should be a national policy that wherever there are medical colleges in the district, it's not that the medical college representative go and ask for it that, okay, I'll participate. It's important that they get a formal position. So whenever the meeting is held, they are invited, and the position of uh, effectiveness is also very important. So I consider that the medical college representative who out of the lot is the most capable person because of his knowledge, his capabilities to make the presentation, do the research, tell the people the effective message, update them as to what is happening in tobacco control. I don't think anybody in DLCC has that capability. So he can be the most useful person to the chair, which is the district collector. And that recognition, I think, is very important. And that's the point I have been making to the our national at the national platform also and to the ministry, that this is how this integration should be done. It's surprising and that the National Tobacco Control Program, when it got implemented, it did not include the medical institutions at all. I mean, how can you have the how can you sort of just overlook the fact of the availability of the human resource and the infrastructure we have in the country, which is primarily responsible for providing not only the clinical care, but also the preventive care. The National Tobacco Control Program has not engaged medical institutions. So I think we need to have a stronger advocacy model, and you have given the model. I would love that, yes, you make it more sort of comprehensive and put it in the text form so that we can have more publications with your case study, so that it can also impact the genesis of the policy that I am looking at. So, but yes, kudos to you and best compliments on what you have said, that the small things, addition of small things matter rather than just being there. And I think you have shown very effectively as to how your participation has helped the district of Udupi into reducing the prevalence of tobacco use in the younger population, adolescents in particular. I think that is what we are looking at, that if the youth stop initiating into tobacco use altogether, and if that happens with the birthday restriction, which is the principle behind the tobacco-free generation, I think you have almost reached there with your tobacco control initiative. So I think that's very great, and continue working like that. And I had just 2 days back, I was there in a state summit with the state health minister, and we have briefed him on some of the innovations, which include definitely tobacco vendor licensing, which should come in place, the tobacco-free generation, and end game for tobacco. So I think you have perhaps done the right things, despite the fact that NTCP came very late to the district. I mean, it's almost a gap of 10 years, which shows as to how our system works. But yes.
So, Dr. Rakesh Gupta,
appreciated.
thanks a lot. And let us have comments from others also.
Sure.
And it is really good that as per GYTS data, so the prevalence is just 1.5%. That is much below the national average. So I think they can plan for this tobacco-free generation, surely. So we'll have some comments from Dr. Ramprasad, Dr. Hamad, and Dr. Aruna. Just 2 minutes each, not more than that.
Thank you so much, Rakesh sir. Thank you, Dr. Murali, for a very comprehensive overview of what has been done and what we have been able to achieve. I just had one observation or clarification on this particular opportunity. Is there any current data of how many medical colleges are already having a tobacco cessation clinic as on today? Any data available in the country as to how many medical colleges already have an institution, have a TCC set up, have a cessation clinic set up? Because what has happened is, on the dental college front, I would just like to update. About 5 years back, we received a mandate from the Dental Council of India asking all the dental institutions in the country, 324 institutions in the country, to set up a tobacco cessation clinic mandatorily, which will be included in the annual DCI checkup. We have our DCI annual inspections as a part of our educational activities and curriculum activities. So every year, every institution has a DCI inspection. It goes on for 2 to 3 days. So as a part of the checklist itself, serial number 1 was tobacco cessation clinic. Available, not available. And if so, who is going to manage the tobacco cessation clinic? Which are the specialties interested with this responsibility? What is the infrastructure required? And things like that. So that happened about 5 years back. And ever since that happened, all the dental colleges now have a tobacco cessation clinic screening as well as counseling kind of facility established, though it may not be working full term, full functionality in all the institutions. But the medical college front, is there any data available today out of the 724 colleges, 706 medical colleges, as to how many have actually initiated and how many medical colleges have a TCC facility, sir? Just some inputs on that. Thank you so much. A very comprehensive presentation, Murali. Thank you so much.
So, Dr. Ramprasad, as far as I know, 200 plus dental colleges, they have TCCs. And we'll know about the medical colleges on 23rd, when our Honorable HM, he inaugurates tobacco cessation centers. So we'll have a fairly good idea how many medical colleges they have adopted these TCCs. So thanks a lot. Yeah, thank you.
Add to it that the medical colleges which have opened recently, they have actually been working with the earlier district hospital, which have now become medical college hospitals. So
Okay.
they already have TCCs.
Yeah.
Okay.
You got my point, because under NTCP, they were supposed to establish TCC. And what is more important now is that the established medical colleges develop TCCs, one, and
Okay.
all the TCCs are given adequate funding and human resource to run this, because the challenges are threefold. One is the availability of the human resource. Second is the infrastructure which they require, which is not there. Third is the visibility of these clinics. And fourth is the referral to these. So these are four major issues which we'll have to look forward to if you want the TCCs to be really effective and raise the quit rate in the country.
Right. Noted. So thank you so much. Thanks.
So thank you, Dr. Rakesh and Dr. Ramprasad. So may I ask Dr. Aruna to give her comments, very short comments.
Yeah, thanks a lot, sir. So congratulations to and best wishes to Dr. Muralidhar and team for presenting this novel work. I have one query. So you mentioned that one of your postgraduate student has taken a project on the anti-tobacco messages for the school children. So is there at the content of anti-tobacco messages, age of discretion is there? Because this is an age where there is high novelty seeking and the experimentation behavior.
Yeah.
So if you develop a content which is like they may experiment as well.
No, actually, ma'am, this was the question which teachers used to commonly ask us. Their complaint was, you come, talk about tobacco and go. You create interest in the minds of school children, and then you are doing more harm than good. For that, we did a study. It is published in Nicotine and Tobacco Research. It is what we have found out is half knowledge is dangerous. If at all you have awareness, give complete awareness. Don't do hodgepodge work. The students, those who responded to 75 got 75%. We asked 10 knowledge questions, attitude, awareness, about policy and harms. 10 questions. If students answered more, scored more than 7, none of them had tried tobacco. 5 to 7 and less than 5 score if they had got, they had all felt like using tobacco or they had already tried tobacco. So we found this in a sample of 40,000 school children. And after that study, I told to all the teachers in the district, gave them this presentation. So that noise has come down. So nobody questions us. You come here, create a little bit of interest and go away. That makes students learn. Then we tell them now, you give correct awareness. You talk to them about all the harms, not just cancer after 30 years of age. You talk about early problems, intermediate problems, and late problems. Also talk about what government is taking there. What are the policies in place, like ban on public smoking? Why the ban is there? Don't just say the government has banned. Why it has banned? Because second-hand smoke is more dangerous, and that person who regularly inhales second-hand smoke may develop cancer. So we should complete that information. Whenever the students have complete information, I can bet you we have proved in our studies that they do not take up for that.
Because that's a vulnerable population, even to initiate. And another one is like, yeah, that's what I asked, like content discussion.
Yes.
So exposure to the second-hand smoke, those things like was strengthened. Because during every school dental health programs also, so like
Yes.
we used to include like at least a 10-minute session on the tobacco related health effects and health harms actually. So many of the time it used to happen if the teacher who used to use tobacco, all the kids used to look at the master G only or the teacher.
We tell teachers also. So they are the role models and lead. First you cleanse your house, your school first. Don't allow any tobacco sachets or cigarette butts to be lying in the ground. We start off with that because after parents, it is teachers whom the students simulate. So it's
So
quite
as a part of the secondary socialization, the moment they come to the schools and all, the peer group and the teachers, they influence a lot. And whenever like we used to give like tobacco content message, health messages and all. So many of the like kids' body language, you could make out that the teacher is a tobacco user. And like somehow, they have that doubtful thing in their mind, like even to receive the health messages also sometimes. Thank you.
So we have a query from Dr. Rakesh Gupta.
Yeah, my short question is, do you administer them the oath to stay tobacco free to the students in the schools?
We do administer the oath, sir.
Why I'm asking this is that can you follow up on these people, on these students, if they have all stayed tobacco free or some of them have experimented or are current users of tobacco? That will be very useful finding that
Sure.
we require.
Currently, one study is underway. We will incorporate this question, sir.
So, Dr. Hamad, do you have any query or any comments? Anybody else who has any query or comments? Otherwise, we can just proceed for the vote of thanks, formal vote of thanks. So thank you, Dr. Murli and Muralidhar and Dr. Ramprasad, Dr. Hamad, Dr. Aruna, Dr. Rakesh Gupta, who has been always guiding us. Actually, I always ask him for the concluding remarks. This time I started with him. So thanks a lot. Thank you all participants for joining. And the recording will be shared a day after. So you can just watch the recording and you'll enjoy the work of Dr. Muralidhar M Kulkarni. He has done an excellent work and in tobacco control. Thank you.
Very nice.
Thank you all.
Thank you. Bye-bye.
Namaskar.
Thank you so much. Thanks a lot. Thank you so much.
Thank you. Thank you.
Thanks, Murli. Thanks.
Thank you.